Okay, so now we're trying to look at chronic kidney disease, which is the next thing which we'll be discussing. That's CKD. So for chronic kidney disease, you know, when you say something is chronic in medicine, that thing has been there for a while. It has been there for a long time. So just so you know, it's a long-term condition. All right. So it has been there for a while. The kidneys have been affected. It has followed all these stages and is now deteriorating what's very bad. You know. So this is where the kidneys they lose their ability to be able to filter waste and excess fluids from the blood. So it's progressive and it's often silent in the early stages. Okay. But of course, used to lead to what? Complications. Okay. Used to lead to complications. Sorry, I'm coming. So it's a persistent kidney damage or kidney function is reducing and it's chronic because it's lasting more than 3 months. So it can be caused by several things. We are just listing but a few. Diabetes, high blood pressure, glomerulonephritis, polycystic diseases. We have used drugs for too long. Those drugs have to be excreted by your kidneys. You know, then toxins, any alcohol, anything that is harsh to your kidney. Okay, these are the stages. Okay, so stage one is normal kidney, the function is normal. Okay, stage two is mild reduction in function. You can basically talk about the glomerular filtration rate. It is dropping below 90. Then stage three is moderate. Symptoms begin to show. It's dropping to about 45 to you know 59. They also have the 3B. It's still moderate, but then it's going up to 45, 44. So symptoms is okay. We have the stage four, which is severe, then the stage five, which is kind of like failure, and it goes down toward the end stage renal disease. So symptoms include the person is weak, swelling in the legs, ankles, and around the eyes, and the person is not urinating uh, frequently again. And when they urinate, that means the kidneys are not making good amount of urine. When they urinate, it's colored, it's foamy, nausea, and also loss of appetite. So you diagnose this using blood tests to check the levels of creatinine, urine tests to check the levels of proteins or albumin in specific that is in urine. Then also ultrasound and CT scan to now access how big your kidney is and the structure. Okay. Then they also always measure their blood pressures and also, checking for the heart. Management, the first approach to management is the person has to change the way they are living. So they should control their blood sugar, control the blood pressure, reduce the amount of salt they are always taking, and they should stop smoking. Then they can bring in drugs like the, angiotensin receptor blockers, which will block angiotensin 2 and will make that this angiotensin 2 will not be constricting blood vessels. Then diet, they should be taking foods that have low proteins, low sodium, balanced potassium, and also balanced phosphorus. So this is what we have as related to chronic kidney disease.